Gastrointestinal pharmacology. GIT. 1. Antacid drug. 2. PIS. 3. H2 receptor. 4. Laxatives. 5. Antidiarrheals. 6. Antispasmodics. 7. Antiemetics. 8. Anti-H. pylori. Antimicrobial agents for eradication of H. pylori, amoxicillin bismuth compounds, clarithromycin, metronidazole. PP is proton pump inhibitors. Usage. These medicines are used to treat 1. Stomach ulcers. 2. Duodenum. 3. GERD. Working mechanism. PPLS is connected to this H/K pump. The pumps H into the stomach to bind with chlorine and form HCl and increase acidity in the stomach. When PPLS bind to the pump prevents the pumping of H into the stomach. Dosage. Take it twice in the morning and in the evening, and it is preferable to take it half before eating an hour. The scientific name for this group ends with the syllable prazole. Trade name and scientific name. 1. Omeprazole. Trade name Gasec. 2. Lansoprazole. Trade name Lancid. 3. Pantoprazole. Trade name Pantodar. 4. Zomeprazole. Trade name Nexium. H2 receptor, histamine 2 receptor antagonists. Usage. These medications are used to treat 1. Stomach ulcers. 2. 3. Indigestion. And also the recovery of the esophagus. Working mechanism. When histamine is associated with the H2 receptor, it leads to acid secretion in the stomach. But these drugs act as a competitive discount that prevents histamine from being linked to the future and thus prevents acid secretion of the stomach. What are the medications used? Khalid. The medications used. The brand name and the scientific name. 1. Somtidine. Tagamet. 2. Ranitidine. Zantac. 3. Famotidine. Pepsid, Famodar. 4. Nisitidine. The scientific name of this group ends with a syllable. Tidine. What is the dose used? Khalid. The dose. Take twice a day before eating half an hour. Note. Somtidine prevents many CYP450 enzymes which leads to many drug interactions. So it may not be given with theophylline and enlarged bronchial warfarin and clopidogrel. Contraindications to blood clotting. Somtidine has an anti-androgen hormone effect. Antacid, antacids. Usage, used to treat 1. Digestive disorders, such as indigestion. 2. Stomach ulcers. And 3. Duodenal ulcers. And 4. Gastroesophageal reflux. Mechanism of action. These compounds neutralize HCl in the stomach, and thus treat disorders digestive. Medicines that contain aluminum cause constipation. Medicines containing milligrams cause diarrhea, so the manufacturers combined Al and milligrams into one compound. These medicines have trade name and scientific name. What are medicines used to anti-acid? Khalid. The medicines used to anti-acid. 1. Salt alginate potassium. Trade name Gaviscon. 2. Mehydroxide. Trade name Milox. 3. Sodium hydroxide. Trade name Malox. 4. Calcium carbonate. Trade name Renai. Magnesium carbonate. Renai. Okay, call it. Thanks. Notes. Simthicon, which is a gas repellent, can be added to antacids, such as Malox Plus. Medicines that contain sodium, bases such as Gaviscon. No, it can be given to patients with high blood pressure. Ranai is dangerous for those with calcium in the blood. Antiemetics, anti-nausea and vomiting usage. These drugs are used to treat or prevent nausea and vomiting. The trade name T N and the scientific name. Question, Khalid. Can you tell me trade name and scientific name to antiemetic? Question answer. Trade name and scientific name. 1. Domperidone. Trade name Modalam. Dompe. 2. Metoclopramide. Trade name Placel. 3. Prochlorperazine. Trade name Stomatil. 4. Cinnarizine. Trade name Stigerin. 5. Ondansetron. Trade name Zofran. 6. Beta-histamine. Trade name Beta-Circ. 7. Dexamethasone. Question. Khalid. What is cinnarizine use? Question answer. Cinnarizine is used to prevent motion sickness and should be taken before traveling in 2 hours. Question. Khalid. What do you know of ondansetron? Question answer. Ondansetron. Trade name Zofran. Is safer for children and pregnant. It is used with vitamin B6 for pregnant women. Question, Khalid. What are the advantages of domperidone over metoclopramide and picloprazil? Question, answer. Domperidone is distinguished over metoclopramide and picloprazine that 1. It does not affect the nervous system, and 2. It does not cause tension because it does not cross the blood-brain barrier. BBB. Okay, thanks Khalid. Note. Dexamethasone is used to treat nausea, especially in patients undergoing chemotherapy, such as cancer patients. Laxatives. Constipation drugs. Usage. These drugs are used to treat chronic constipation or acute constipation. Atheism. Cause of constipation. What are causes of constipation? Khalid. Causes of constipation. Constipation may occur when some diseases occur, such as 1. Diabetes, 2. Thyroid disorders, 3. Parkinson's disease, or because of 4. Pregnancy. 5. Drinking drinks that contain caffeine, such as coffee and tea. 5. Alcoholic beverages. There are some medications that cause constipation. They are 1. Opioids such as codeine, 2. Iron, 3. Antidepressants, 4. Anticholinergic drugs, 5. K-channel blockers, 6. Adrenergic agonists, 7. Non-steroidal anti-inflammatory drugs, NSAIDs, 8. Psychotropic drugs, 9. Antacids, especially Caco-3 and aloe. Constipation medicines are divided according to their mechanism of action into several 3 types. 1. Fiber, bulk-forming laxative. 2. Osmotic laxatives. 3. Emulant laxatives. Okay, thanks. Constipation medicines are divided according to their mechanism of action into several types. Fiber, bulk-forming laxative. Striculia equals normochol methylcellulose equals mechanism of action. These medicines are produced from the fibers of fruits and vegetables. And after ingestion, it is digested by the colonic bacteria. Thus increase fluids, water retention, which leads to flatulence and enhanced bowel movement. Note. It is not permissible to take it before bedtime, because it may cause bowel obstruction. And the patient should be advised to drink more fluids. These medicines are safe, so they can be used by pregnant women and nursing mothers, as well as for the elderly. Osmotic laxatives. Lactulose lactose. Lactulose equals laxolac_lactolac. They are bilateral sugars. After eating them remain in the intestine and not digested. And it attracts fluids, water retention, and thus causes swelling of the intestine, and enhances the movement of the colon. Note: this medicine is safe and can be used for pregnant women, children and the elderly, and its taste is sweet and does not affect diabetics. Working mechanism: it causes severe irritation to the colon, which increases bowel movement, and thus stimulates the disposal of waste. Note: long-term use of this group causes loss of smooth muscle strength, and thus the patient's dependence on it to defecate. Emulant laxatives. Stimulants. Trade name and scientific name: bisacodyl, Dilicalax, Senicide, Sinade. Castor oil. Castor oil. Mechanism of action: cause severe irritation to the colon, which increases bowel movement, and thus stimulating the elimination of waste. Note: long-term use of this kit will cause a loss of potency smooth muscles, and thus the patient's dependence on them for defecation. Antidiarrheal drugs are divided into two types, according to their mechanism of action. 1. Antimotility drug. 2. Adsorbents. First. 1. Antimotility drug. First, mechanism of action. These drugs act on the movement of the intestines, where they bind with opioid receptors. Opioid receptors in the intestine. And activate it. Activation of these receptors slows down bowel movements, thus stopping diarrhea. Trade name. Scientific name: difenoxylate, atropine lametil, Enro_stop. Vencodyl, Dire_stop, Imodium. Loperamide. Note: these medicines are not given to children under the age of 2 years. 2. Absorbents. Mechanism of action: these drugs are excellent. Where the material sticks to the intestinal wall and diarrhea stops. These medicines are: A. Pectin plus kaolin. Notes: 1. Kaolin is not recommended for the treatment of acute diarrhea. 2. Kaolin may form insoluble compounds with some drugs in the digestive system and reduces its absorption, so it is advised not to take oral dosing at one time. B. ERS, oral rehydration therapy. Antispasmodics, anticonvulsants, spasmodics. Usage: these drugs are used as medicines to relieve symptoms of intestinal disorders, characterized by spasm of smooth muscles. These medicines are: trade name and scientific name: 1. Hyoscine_butyl bromide. Trade name: antispasmin, buscapine. 2. Bibeverin. Trade name: Dustalin, Colofac. 3. Alvarine. Trade name: Spasminol. Note: 1. Medicines Hyoscine_butyl bromide N cannot be prescribed for patients with an enlarged prostate gland. Note: 2. Medicines Bibeverin are used to relieve pain in the syndrome IBS.